Scrubbing. Distilled water is considered best for scrubbing. Alternately, purified, boiled, or chlorinated tap water can be used. Removal of all the jewelry and wristwatches prior to scrubbing is mandatory. First step is of 3 minutes. Lather is worked with soap up to 3 cm above elbow for about 1 minute. The soap is then rinsed off. The flow of water should always be from fingertips to the elbow. Repeat these 3 times. Second step is of 4 minutes. The next step is scrubbing of the hand with povidone iodine or chlorhexidine. Scrub each hand with the other like hand to hand, right palm over left dorsum, left palm over right dorsum, palm to palm with fingers interlaced, back of fingers into opposite palm with fingers interlocked, rotational rubbing of thumb with opposite hand, rotational rubbing of the tips of fingers and thumb of right hand and left palm, and right palm and then opposite. Hands are rinsed thoroughly under running water after scrubbing. Repeat these twice. Remember, keep hands above the level of elbow throughout scrubbing. Keep hands away from the body with hands above the level of elbow after scrubbing. The hands should be dried with a sterile towel. Begin with the hand, wrists, and then forearms. Avoid to and fro movements to prevent contaminating clean area. Avoid splashing of water while scrubbing. Don't dry up to elbow. Gowning and gloving technique. Gowning. Pick up the gown holding it well away from the trolley and your own body. Hold the neckband and unroll until the sleeves are seen. Slide both hands and arms into the sleeves at the same time. The floor nurse or the assistant slides her hand under the gown at the shoulder and pulls out and fastens all the back tapes. Remember, do not keep the hands below the waistline, near one's neck or shoulder. Do not touch the axillary area or back of the gown once gowned. Gloving. There are 2 methods of gloving, the open method and the closed method. Open method. Take chlorhexidine or its equivalent solution on bare hands. Pick up the first glove by gripping its cuff with one hand and slide the other hand in. With the glove hand, pick up the second glove by sliding hand under the cuff, outside of the glove, and slide the ungloved hand in and release the grip. If gowned, the cuff of the second glove is pulled over the stockinette sleeve of the gown. The cuff of other glove is then pulled over the stockinette sleeve. Closed method. The hands are not pushed beyond the stockinette cuffs of the gown. The cuff of the left hand glove is grasped through the stockinette part of the right sleeve. The left hand is inserted into the glove, and the glove, grasped by the right hand, is pulled over the left hand. After stretching the cuff, the glove is pulled over the sleeve, and the hand is forced through the stockinette cuff into the glove. The second glove is put on in a similar manner, except that the cuff can be grasped with the already gloved hand and the right hand is forced through the stockinette cuff into the glove. After wearing the gloves, it should be cleaned of the powder on the surface by washing with cotton soaked in Ringer lactate solution. It can cause sterile uveitis. Take chlorhexidine or its equivalent solution on gloved hands to form a layer on the surface to further enhance antisepsis and allow it to dry before starting the surgery.